everyone, welcome. This is the Voice of Eve. Our topic today is women and dental care and health for themselves and for their families. Please stay tuned with us. We'll soon be back. Someone has said that a very bad toothache is like the experience of hell on earth. Yet, it need not come to that. Unfortunately, however, some women and their families are yet to learn that a stitch in time saves 9 when it comes to dental health and care. Our teeth are supposed not only to help us to chew food, but also to beautify our faces. Yet, just how much attention does the average Nigerian family pay to dental care and health? Please join me as we hear from the experts and practitioners. I am Dr. Violet Arene. Hello everyone, welcome. If you're just joining us for the first time, this is the Voice of Eve. Our topic today is women and dental health and care for themselves and for their children. We are privileged to have with us today a specialist, an expert, and a practitioner to enlighten us on these sensitive subjects. She is Dr. Mrs. Nike Awotile, a consultant surgeon, dental surgeon, and a practitioner. Madam, it's a pleasure.
Thank you. You're welcome.
A serious problem which is often neglected. The general impression by many women and their families is that dental care and health are the least of their problems. In the face of all the problems, why dental care? Is there any reason for women and families in this nation to reverse this impression?
Yes, there is. This impression has to be reversed because the mouth is the gateway to the whole body. There are 2 major diseases that affect the dental system. We have the gum problem, and then we have the tooth decay. So parents or mothers have to be very careful in taking good care of their children, because from simple gum problem, it can advance into something that could even end up in the patient losing his or her life. Because gum problems, it starts with swelling, bleeding, and from there the infection can go straight into the bone, and from the bone it can go into the bloodstream, and anything could happen. So, and with the tooth decay too, the tooth will start with a small hole. From the hole, the bacteria will go into the pulp. From the pulp, it goes into the bloodstream, and anything could also happen, because the mouth or the teeth and the mouth, they all lead into some spaces in the body, on the face, that can lead to the bloodstream, and anything could happen. So mothers should endeavor to take good care of their children as they are feeding them. When they wake up in the morning, you have to check your children's teeth. Check the mouth. As you are brushing their mouth in the morning, you check whether there is swelling, whether there is bleeding, whether there is hole. This used to happen to us in those days when we were in public schools or private school. They used to do school inspection. In the morning, they look at your teeth, they look at your fingers, they look at the way you are dressed. But charity begins from the home. Mothers should endeavor to look after their children. And those mothers that are working class mothers should not leave all this to their house help. You know, some mothers rush out of the house. They don't care about whether the child has eaten or not. They are just ready to go to work. What they should do is, sometimes during the week, probably weekend, they should inspect their children, starting from the mouth. Because some certain things occur in the mouth that will be a manifestation of what is happening in the whole body.
Wonderful. This is a very wonderful enlightenment.
Yes.
Because we often talk of teeth, but we don't normally connect the teeth problem with the gum. So now what you are saying is that if the problem doesn't come from the gum, it comes from the teeth.
Yes.
And that bleeding from the gum is serious.
It is also serious, because that is what we call, in children, it will be what we call gingivitis. That is inflammation of the gum as a result of poor oral hygiene. That is not brushing, not taking care of the mouth. You know, mothers should endeavor, as soon as a child has teeth in the mouth, they should use baby brush to brush the teeth. Before a child has teeth, they can use cotton wool and little paste to clean the mouth in the morning, and maybe, and most of the time, at night too, before they go to bed. But these days, some mothers don't care.
Do you really think that people are aware that children, before they go to school, should brush their mouth? I'm not even sure that is ensured these days.
Because these days, it's possible for children not to brush.
Yes.
Because these days, mothers would have rushed out of the home, except homebound mothers,
Yes.
like maybe market women, farmers. Those are the ones that will be with the children in the mornings. And if they are not dentally aware, if they are still of the old feeling that the teeth are the least of their problems, they might not care about cleaning the mouth. But it is good for children to clean their mouth, and even adults, we have to clean in the morning and at night before we go to sleep.
Wonderful. I think we need to hear more about the serious dangers of the neglect of what you are saying now.
Yes.
Like I've heard that dental problems or gum problems, whichever, because they are interconnected, can be connected with diabetes or stroke or whatever. Can you enlighten us, please?
With diabetes,
Yes.
what happens is, you know, they have blood sugar, a lot of sugar in their bloodstream.
Yes.
So such people are prone to infection. So if they don't take care of their mouth, the infection would, the blood sugar will make their mouth to always have infection, right? And with the infection, it will aggravate their condition. So such people have to maintain good oral hygiene so that they don't fall prey to infection. We all have normal commensals. I mean, everybody has bacteria in the mouth. But the body defense mechanism helps us to fight the bacteria. But if there is too much sugar, you will not be able to fight it. And the infection will override your immune system that fights infection. So people with diabetes should take special care of their mouth, because little infection like this will be overblown and could lead to anything.
Serious.
Something very serious.
Something serious.
Serious. It can lead to blood infection.
Wow.
Yes.
This is very enlightening. Who would have thought that this mouth region is so critical to our well-being? And our problem really is, from the few comments we've had, people who say they don't know where to go for dental care. They don't have enough dental education, dental health education, and some say it's not affordable for them.
So let's start with affordability.
Yes.
Dental care, it depends on what you want. But for the majority of our people, because this society is we're not wealthy enough. We have government hospitals. Most of government hospitals that have dental clinics are affordable. And the government is really trying in the aspect of primary health care, which starts from local government sectors. From local government sector, the health centers there, they have some people who visit them, who give talks on dental care. From there, whatever they cannot handle, they send patients to secondary level, which is general hospitals. Where what the general hospitals cannot handle, they send to teaching hospital, which is the tertiary care level. And government has so done it that you pay little or nothing for the care. Wonderful. Especially for minor ailment. It is when you now have advanced problem that it becomes a little bit expensive. Okay. So government has taken care of that aspect.
Okay, so people should really check from a general hospital.
Yes, they can start with local government that is close to them. Okay. The closest local government health center that they have. Whatever those ones cannot handle, they send them to general hospital. Whatever general hospital cannot handle, they send to teaching hospital.
Wonderful.
So that's how it's been set up.
This is the voice of Eve, and we really want women to hear what you are saying. Can you enlighten us on the aesthetic, that's the beauty aspect of having good, healthy teeth for women?
Like I said earlier on,
yes.
I said the mouth is the gateway to the whole body. Yes. And the teeth makes up the face. A face that has no teeth becomes that of an old man or old woman. And that person will, a young person looking like an old person will not like herself. And it's been realized in our society that an ugly man can always get a wife as long as he has money. An ugly lady that doesn't have teeth will be relegated to the farm or to the village. Even the villagers will reject her. But if she has fine set of teeth, yeah, and she's local and her face is, elegant looking, even the most posh man will still request for her and train her and bring her up the way he wants her to be.
Beautiful. So actually, what you have said is very pertinent. So women should actually be more sensitive about the health of their teeth, because it makes us more beautiful.
More beautiful.
And we know what happens when a woman is ugly.
Yes.
Her problems are doubled.
Yes, that is true. You're right.
So actually, taking care of the teeth, you are telling me, will help a woman not to have secondary ugliness.
Yes, you are right. There is one thing I want to say about taking care of teeth. We have said that they can go to the hospital, starting from health centers where they could get help if they have any dental problem. It is also pertinent that they should visit the dentist at least twice a year, every 6 months, for check-up and cleaning of their teeth.
Wonderful.
And then mothers should endeavor that they themselves, their children, their husbands, they brush their teeth in the morning and last thing before going to bed at night.
What food?
Fruits.
Food is worse for dental deterioration.
The food that is worse is what we call refined carbohydrate. Like all these pastries, chocolates, sticky things and sweet things are bad. But at the local level, dodo is another thing. I'm not saying don't eat dodo. Dodo too is sticky. Yeah. Fried plantain is sticky and sweet. So you don't easily get rid of it from your teeth. So it is better you imbibe that habit of brushing up before you go to bed at night, because it is in the night that the bacteria in the mouth will have food to feast on, and the end product of this will be acid.
Okay.
that will etch your teeth.
Okay.
So we have got to brush our teeth before going to bed. And if you are the type that loves chocolate and all this, the nearest available opportunity you have, just brush your teeth. Make sure that those things are not on your teeth.
Wonderful. Yes. You've given us wonderful, practical, guide for health and dental health care.
Thank you.
So just say final words to women before we close.
Okay. My final word to you is that you should know that the mouth is the gateway to the whole body. Endeavor to take good care of your teeth and those of your children so that you will be able to have beautiful looking children in future that you'll be proud of, and their market values when they are, if they are ladies, will be very high.
I like that. Thank you, Dr. Awotile.
Thank you, ma'am.
Women increase their market value through their beautiful teeth.
Yeah.
Thank you.
Thank you, ma'am.
Welcome back. If you're just joining us for the first time, this is the Voice of Eve. Our topic today is women and dental care and health for themselves and for their children. We're delighted to have in the studio some experts and practitioners. I have here Kunle, a dental nurse from the Lagos University Teaching Hospital, LUTH. You're welcome.
Thank you. It's my pleasure.
Thank you so much. And I have Helen, who is a #1 health promoter. It's a pleasure having you here.
Thank you very much.
Thank you so much. Thank you, always. And then I have Dr. Shehu. This is a dental surgeon per se. It's a pleasure having you, and a foremost practitioner. You are in private practice. You are very welcome.
Thank you very much.
You are all very welcome.
Thank you.
Kunle, some people say that dental health is the least of their problems in Nigeria. Are they right?
No, they are not right. We all know that the mouth is a gateway to the body. If the mouth is not clean, whatever we ingest is also not clean. So it is very good for us to take care of our gateway.
Wonderful. I'm hearing this for the first time. The mouth, which contains the teeth, is the gateway to our overall being. Thank you so much. Dr. Shehu, you're a very senior person in this profession, as a surgeon. Do you think we have enough dental health facilities that are affordable to Nigerian families?
I normally tell people that dental treatment, dental care isn't so expensive. If you have the information, you can always look for the most affordable clinics in town. Again, there are some government establishments that you can walk into, and they will give you the right treatment at a reduced price. So I believe dental treatment isn't so expensive.
Are they really available? Even if they are affordable, where are they?
You could go to a website where free dental informations are given. We also have a blog. There's a blog there where you could read articles on daily basis, and also there is like a directory where you could search for a dentist, a close-by dentist in your area. All you need to do is type in whatever keyword, like dentist, Lekki, Lagos. Then you search for it. It brings out the list of clinics around.
What is that blog?
www.mydentist.com.ng.
Wonderful. www.mydentist.com.ng is the university site for dental health care for us, and it's free.
Yes.
And it's available to all.
Oh.
Now, Helen, Have you ever seen a woman whose face turned ugly because she lost she had some of her teeth pulled out?
Yes, I've seen a couple of them, especially the front teeth. When you see a woman that doesn't have that has a missing tooth in front, she will look ridiculous. And most of the times, the woman, not only that she will lose her beautiful face, but she's going to lose confidence. And sometimes you see them when they are talking, their speech is somehow the very funny way of talking, and you'll be wondering what's wrong with this woman, and all because the poor dental health. So I think women and families should take it very seriously.
It's actually serious.
It's a very serious
Dr. Sheung, maybe you can give us the final words on this. What, in the case of children, especially those ones who wear braces, do the braces work? Must they come to that, to wearing braces? Those overlapping teeth, should they happen that way? Those who lose their tooth and their jaws sink, must it happen? Tell us, what finally should we know about dental care and dental health?
Orthodontic, that's braces, are set aside to move teeth or for teeth alignment. There's an area, it is a specialized area in dentistry and requires specialists to actually monitor the movement of teeth. Of course, as you rightly said, there are some people that their profile, their teeth is maybe malpositioned and all that, proclined and all. The braces do help. It really works. And it's if the mother takes the child, especially the children, to the dentist at an early age, you will find out that the dentist will be able to foresee what may happen and also institute the right treatment.
Very good.
You cannot remove the aspect of bringing your child to the dentist. There are some things that we could do. There are some treatment modalities that we could institute that will save your child and you from incurring expenses in future and also losing teeth, which is the worst part of it. One, we could do scaling and polishing. That's oral prophylaxis, cleaning the mouth. 2, we could apply fluoride on the surfaces of those teeth. 3, we could also put dental sealants. That's to cover the surfaces, the occlusals of the top of the teeth, to prevent the child from caries attack.
So thank you so much.
It's very important.
And everybody should go to, if you have access to the web, go to www.mydentist.com.ng for free information on what is available to you on dental education on a daily basis. Thank you so much for this wonderful contribution to the health of Nigerians as we seek a national development. This is a very important aspect, especially since the teeth is the gateway to the whole body. Well, viewers, you have had it all. Dental care and health are actually at the level of primary health care for every woman and her family in this nation. Please go and find help before it's too late. Also look into www.mydentist.com.ng. You will have free information as to where to go. A stitching time saves 9 when it comes to dental health and care. Thank you for watching.